Here we are with diabetes. How do we define diabetes and how is diabetes occurring and increasing, and the prevalence is increasing, and also the incidence? It's all due to the diet we take and also due to the lifestyle we maintain. Excess calories, whatever we have in our food, gets converted into fats, whether we take it in the form of carbs or proteins or fats. So, the excess calorie intake is the problem for diabetes in most of the cases. Exceptions include type 1 diabetes, where that's an autoimmune disorder where your pancreatic cells get destroyed, the beta cells, by your own body, which produce the beta cells produce insulin, and after they get destroyed, they no longer can produce insulin, and we have diabetes that is controlled only by insulin is the only choice for those type 1 diabetes. But we are talking about today and focusing more on the type 2 diabetes, which is very prevalent in the whole global world. So, how do we define diabetes? We have a few parameters here. Number one is the HbA1c, and number two is the fasting uh, plasma glucose, and we have the oral glucose tolerance test. This is how we can define diabetes and diagnose diabetes. So other than this, we also have the postprandial sugar, for which the parameters are not mentioned here, but yes, we'll get into that in a moment. So let's start with the A1C. So what does it mean and how can we assess our blood sugars? So A1C is also known as hemoglobin A1C, HbA1c, where patients have those hemoglobin molecules associated with the glucose, and that's how the glucose, when it is attached to the hemoglobin, we calculate the hemoglobin attached to the glucose and measure the percentage of the blood attached to that glucose. So, how do we define diabetes with HbA1c? The normal levels usually range between less than 5.7%, and for pre-diabetes it is greater than or equal to 5.7%, and the upper range for pre-diabetes is also less than 6.5%. Now coming to the full-fledged diabetes, once you have greater than 6.5, now the usually is an irreversible condition when the type 2 diabetes becomes uh, a chronic disease when it is greater than 6.5%. But can you maintain the sugar levels less than 6.5% even if you have full-fledged type 2 diabetes? The answer is yes. And how can you do that? Again, it comes to the possibility of taking the less calorie intake, maintaining those calories, and foods with low glycemic index and with high fiber, and also your regular exercise along with weight loss. Weight loss, how much weight loss? That will be less than uh, losing losing your weight to 5 kilograms over a few weeks. That's how you can maintain your blood glucose levels as always. Now the fasting plasma glucose. What is it and how do we define it depending on the terms? Yes, we have this fasting plasma glucose here where we can see the normal range is less than 100 milligram per deciliter, and if it's pre-diabetes it is greater than or equal to 100 milligram per deciliter or less than 126 milligram per deciliter. And that's how these pre-diabetes is defined. And the full-fledged type 2 diabetes, that is greater than or equal to 126 milligram per deciliter. And overall, when we look at the graph, again, if you want to have a plasma glucose on the fasting 100 milligram per deciliter, we should always focus on the lifestyle and the diet modifications that can make us healthy and also prevent a lot of chronic diseases. Most of the diseases that now today are due to the adiposity, ABCDs, those we call it. That is the adiposity based chronic diseases. Now, when we talk about the hours of the glucose that we have, the hours of the meal that we have to make a note of and calculate is the fasting glucose should be measured from 8 to 12 hours, but it can go up to 13 hours as well because the food we take in takes at least 1 hour to get digested, and the first blood glucose molecules come into the blood after an hour in our bodies. So anywhere between 8 to 13 hours is good, but along with that we also have to remember that some of the digestive systems are also variable, that we can also restrict it to only 12 hours. Beyond 13 hours, maybe we that's not so reliable, the fasting blood plasma glucose. That's why this is preferred. Now, what is OGTT? That is the oral glucose tolerance test, and what are the parameters in the normal and versus pre-diabetes and diabetes. The oral glucose tolerance test, this is 75 gram blood glucose. You basically drink that water and wait for 2 hours, and then you go on to measure the blood glucose in your through a test, through a strip test or the other methods of the test of when we have the normal plasma glucose less than 140 milligram per deciliter, we define that as a normal patient or a normal healthy individual. That's not a patient, that's a normal healthy individual. Pre-diabetes, when we have the blood glucose levels greater than or equal to 140 milligram per deciliter, and also the postprandial glucose. After the oral glucose tolerance test, if it's less than 200 milligram per deciliter, that's the upper border for pre-diabetes. It's still reversible, and full-fledged diabetes in these patients is when the blood glucose levels go up to greater than or equal to 200 milligram per deciliter. So this is how we can diagnose diabetes. Apart from this, we also have the postprandial glucose levels, where we take the normal food we take. Now patients come up with many of the reasons to make their fasting plasma glucose or the postprandial glucose levels lower on the day of the test. That's a kind of cheating or trying to hide their actual blood glucose levels. That's a common thing that we have to avoid them, because these are the things that eventually will help us in the right diagnosis. One day taking less calorie intake just to fool ourselves and getting the tests under control, the plasma glucose under control, is not enough. It should be your daily 24 by 7 routine that has to be monitored and controlled throughout your life. So, what do these PPG mean? Now, diabetes and the blood glucose levels, they can vary on the age also. They can age, they may vary depending on the age, the gender, health history, and also the lifestyle or the diet. Now, what is the 2-hour postprandial test based on the age? For those who don't have diabetes, we have to take, it is as less than 140 milligram per deciliter. Some of the times when usually patients come up, uh, they have high plasma glucose levels due to either stress or other factors, um, you know and for then we have to repeat the test after 1 or 2 days to check whether it was due to stress, or you know it is due to the diet, or he also has full-fledged diabetes. But for the diabetics, the postprandial glucose levels are less than 180 milligram per deciliter. Now, one more point of note here: if your blood glucose level is still high 2 hours after you have eaten, or if it is high of 1 hour after a gestational diabetes glucose tolerance test, it could mean you have diabetes. This is a simple blood sample that is drawn from the vein, and then we have this from the arm or the hand. That's how we check the blood glucose levels here. Now, coming to the prevalence of the diabetes in India, as we can see here, uh, what we have here is a map of our country, India, and you can see the red ones are the red states are those that have high prevalence of diabetes, that's greater than 10% of diabetes in the whole country. And then we have the 5 to 7.5% prevalence in Rajasthan, Madhya Pradesh, Bihar, Jharkhand, Assam, Arunachal Pradesh, Nagaland, Manipur. Greater than that 10%, uh, you know, is in the states like Kerala, Puducherry, Tamil Nadu, Karnataka, Maharashtra, Punjab, Chandigarh, Haryana, Himachal Pradesh, Uttarakhand, New Delhi, Sikkim, West Bengal, Meghalaya, and Tripura. Survey yet to be commenced is it's pending in Jammu and Kashmir, probably due to the volatile situations over there and the uh, life threatening conditions researchers have to work under. Both the civilians, the police, and the military are in danger due to that being a border area. Now, the other ones, the yellow ones here, are the prevalence is less, and Uttar Pradesh, interestingly, is in green because 0 to 4.9%, and I attribute it to the poverty over there because that's a poor state actually, uh, and maybe people are not having so many calories over there, and that's good in a way. What about the other things here that the map can tell us is that most of these states, the Karnataka, Kerala, Goa, Maharashtra, Himachal, Uttarakhand, Punjab, Chandigarh, Haryana, Sikkim, West Bengal, Tripura, all of these states have consuming a lot of calories. Most of the patients are consuming those calories here. Most of the carbohydrate diet, the diet is based on carbohydrates, and the less exercise, and also a lot of fatty foods, the fast foods with high glycemic indexes. These and obesity and adiposity are leading to diabetes in most of these states. So, what can we do to prevent them? Cut the calorie intake, uh, maintain a healthier diet, and also move around. So, now we summarize by a talk by this slide here, that is telling us that the intraocular pressure in the eye, the thyroid, the diabetes, cholesterol, triglycerides, hypertension are silent and slow. You need to check and monitor every 6 months at least, but preferably 3 months. So that's how things go on here with diabetes. That was a basic description and the prevention and management of diabetes. Thank you for watching. Have a great day.